Hey, this is Matt Urtz, the Madison County historian. We are still working to document how the COVID-19 pandemic has impacted different people, places, businesses, and organizations. So we're very lucky today to have with us Sam Cooper, the managing governor of the Board of Governors of the Community Wellness Center in Hamilton. Sam, thanks for being here.
You're more than welcome. Appreciate your invitation.
So talk a little bit about what is Community Wellness Center?
Well, the Community Wellness Center started about 20 years ago. It was intended at that point to rehab people with coronary conditions here in the Hamilton area. Gradually, the center evolved as a place to go when rehab is finished and other medical needs, and the physicians in the area wanted a place to send folks to exercise to maintain a healthy lifestyle. So that's how we began 20 some odd years ago, started by Community Memorial Hospital here in Hamilton. And along with physical exercise, the center has evolved to become a place where folks interact and socialize, which we think is just as important as physical well-being, particularly in this time when people are at home, can't get out or afraid to get out because of the virus. And socialization is critical to maintain not only physical, but also mental health.
Okay, so can anyone be involved with this, or do you have to be rehabbing?
No, you don't have to be rehabbing. Anyone can come in and apply. One of our unique characteristics, however, is that we do require a physician's approval, physician recommendations regarding what is appropriate, what is acceptable to the physician for that specific client. The physician then completes an assessment form. It's returned to our trainer who reviews it. And then we invite the person to come in to do an evaluation session. Typically, that's 45 minutes to an hour-long individualized session with a trainer where he tries to determine exactly where the person is physically in terms of exercise. And from that, the trainer then takes the physician's input and his own input from the evaluation session and meets with the individual to establish a set of goals that are realistic, goals that improve health, goals that improve the ability to perform. And then an individual plan is written and given to the member. So yes, anybody can become a member, and we do follow the protocol of physician involvement. Incidentally, as the physician involvement is a continuous process, as a member works out at the center, we're provided with a card that identifies at the end of each session, how many how many minutes they spend on the treadmill, how many minutes they spend on elliptical, what kind of hand or small tool equipment have they used, and level of performance. We can also record, if the person wants, we record the heart rate, blood pressure, oxygen level. All that data is recorded on an activity card. And at the end of the month, we have some of our members asking for that information to be sent to their physicians. That's a way for the physician to keep abreast monthly of how their patients are doing.
Okay. So how many members do you have?
Well, that's an interesting question. Back on March 1st, we had approximately 97 members. And today we're still trying to assess the impact of COVID-19 on our membership. We're now down about 40% of our members from back in early March. But interestingly enough, and I just received a report this morning, we've had now, I believe, 6 new members in the last week or 10 days who had no prior commitment to the Wellness Center, and they've joined up, and so we're adding 6 to replace some of the members we've lost. We've also been blessed because by word of mouth, a number of our members have been talking to folks who've been hesitant to return, and gradually we're seeing some of those members who are hesitant starting to come back and beginning their workout programs again.
Okay. So talk a little bit about when did COVID kind of appear on your radar and were you guys required to close?
Well, COVID appeared on our radar probably in February. We began to read about uh, the impact as it had across the country, and of course, the severe impact it had in New York City. And we began to realize this might be coming our way. And so it was in early February that we began to monitor closely. And then, of course, in early March, it was even a more thorough assessment. And then, bang, all of a sudden on March the 6th, we got our orders that we had to close. And so we closed that night at 8 o'clock as directed by the governor. We thought we'd be closed for a couple, 3 weeks maybe, make some minor adjustments, and then we'd be allowed to reopen. It turned out it was 7.5 months later that we got our final approval to reopen after making some substantial changes in how we operate and some of our equipment.
So talk a little bit about the reopening process and what that entailed. You mentioned, you had to change a lot. What was it? What did you have to change and how significant of a cost did you have to incur to do it?
Well, one of the first things we did was we recognized our limitations. And so we turned immediately to our parent organization, Community Memorial Hospital, for advice and consultation. We were blessed because Community Memorial has a reputation for excellence when it comes to cleanliness and patient satisfaction. And we turned to the infectious disease department, and we turned to the facilities department, and we returned to the CEO of the hospital, Sean Fidel, and we asked for assistance. We got assistance that is unbelievable. Sean and his team came down to the wellness center, spent an hour going through the wellness center, looking at what we had and discussing with us what could be done to make it a safe and healthy environment. And we had Shelley Frost from the infectious disease department at Community Memorial. We had Tammy Peck and Steve Mead from facilities, plus Sean, come in with a set of recommendations for us to consider. And they have remained a great source of guidance from that point on in early March through the present day. To meet the plan, we needed to take a hard look at our facility. And we realized we needed outside assistance. Sean was able to arrange for the hospital's HVAC company out of Syracuse to send a representative down to look at our facility in terms of how we provide clean air, how we filter the air that is there, and what additional measures should we take so that we could say to our people, this is a place that's safe, this is a place that's clean, and this is a place that's been certified by experts as meeting the COVID-19 requirements. The gentleman from Syracuse came down, spent an hour, looked at our heating unit, looked at our air handling systems, made recommendations, and the recommendations resulted in three things. One, we replaced our air filter system with MERV 13 filters. The second change we made, by the way, that's the same filter that is used in many hospitals to provide sanitary and sterile conditions. The second thing we did, we went out and we purchased an exhaust and air intake fans. We have those in place. They're operating whenever their members are present. It brings in fresh air, and it also removes air that's in the center. And the third thing we did, which we realized was way beyond what the state was going to ask us to do, but we installed in our HVAC system an ultraviolet light so that any air in our center is, one, cleaned by the MERV 13 filter, and then goes into the air duct system and it is screened again with the ultraviolet light that removes basically anything that's gotten past the air filter system. So we're very comfortable that we have met and exceeded the requirements that the county and the state health departments have instituted. Matter of fact, we had the county come down, two inspectors came in, went through our entire plan, looked at the facility, and certified us to be able to reopen. And that we did on October the 6th.
Okay. Talk about how this will change how Community Wellness Center does business moving forward.
Well, one of the things that our members will notice when they return is we do have the 6-foot distancing requirement. That meant we had to take out a couple of pieces of equipment in order to allow us to have the 6-foot distancing. We require the masks, and we require our members to not only sanitize before they use a piece of equipment, but after they use a piece of equipment. And we rely heavily on our members to self-police, and they've been excellent. We've been doing that for quite some time, but it's been re-emphasized due to COVID-19. We also work with the hospital. We have doubled the number of hand sanitizing stations, doubled the number of sanitizing spray bottles, and we have secured a supply of canned sanitizing material which meets the CDC COVID-19 requirements. We have searched high and low, and we found a distributor, got lucky up in Syracuse, who had 14 cases left. We've made 2 trips now up to Syracuse to secure those cans, and we should be in decent shape for probably the next 5 to 6 months in terms of being able to sanitize. The other thing we did was we had to adjust our hours. We took time off. We closed the center down early at the end of our morning session, and we closed the center early at the end of our evening session to give our trainer, without any interruption, time to go around and sanitize any item that members may have touched during the day. And so we think we've done a substantial amount of work rearranging the center, changing our hours, changing our sanitizing protocols, and we feel very comfortable that we will succeed, if for no other reason than we think we've made the right changes to allow us to continue. Our big goal is now getting our membership back up to where we can be self-sustaining, where we can be a viable operation. Our program must be self-sustaining. That's an agreement we have with the hospital, our board of governors made back when we took over in January of 2017, that we would provide all the funding to operate the wellness center. We would not be a cost factor for Community Memorial Hospital. And until COVID-19 struck, we were at that point. We were very fortunate. Our members have been loyal, and also our members have supported us financially so we can operate the center.
So if somebody wanted to join, how could they find out more information?
Very easy. You can call us at 315-825-0163, or you can stop by the center. We're located at the S&S Appliance Plaza in Hamilton, across from Big Lots and McDonald's. Come on in and take a tour. The trainer is there all week long. He is there to assist in any way. Pick up an application, complete the application, return it to the trainer. We'll forward it to your physician of choice. When the physician has responded back to the center, we'll contact the individual and we'll arrange for a time to come in and do that evaluation of their ability level and discuss what goals they have and arrange for when they want to come in. We're open from 5:30 in the morning until 11:45, and again from 3:30 till 5:30, 5 days a week. Saturday mornings from 8:30 to 11:30, we're open. So we're open basically 5.5 days a week. You can pick the time you want to come in as long as we have space available. Again, we have a limitation because of COVID-19 restrictions on a certain number of members to be present, plus the trainer. And so you can come in basically 5.5 days a week if you wanted, as long as there was space available, and work out following your plan or work with the trainer if that's necessary. We modify programs, update programs as you progress towards your goals. One of the things we have undertaken now with a new trainer, we do have a new trainer, Gary Morse. Very fortunate to have him. He's been extremely well received. But Gary has begun to move us more and more towards flexibility, mobility, and balance. Three aspects of aging that are more and more in need. And Gary's been excellent about setting up a program that focuses on those three needs.
Is there anything else you'd like to say?
Well, more and more we're getting people coming in, including people from out of the area, who are asking about membership. And I believe, unlike many of the commercial establishments and other fitness or gyms, I believe we can make it because the need is there. Folks realize that it's a safe place, price is reasonable, and that we're there to make sure each member benefits from a well-designed program that meets their needs and goals.
Sam, thank you for taking the time to talk to us today. We've kind of told everybody that we hope we don't have to talk to you again, but maybe down the road, if this doesn't seem to subside, we'll give you a call, and we wish you nothing but the best.
Thank you. We look forward to it, and we appreciate what you're trying to do for the community. It'll be something 100 years from now, we look back and we're going to say, wow, we survived in 2020, a really difficult year, but we survived.
That's the
Thank
key.
you for having us. Thanks.
Thank you.